This is Royal Television. We inspire.
My names are Doctor Paul Jesuyajolu, and I'm 54 years old now. I established Graceland Hospital in 1992 in Ekpe, and we have been in operation for about 25 years now. Among the things we do is majorly we're into surgery, pediatrics, O&G, deliveries, maternity care, and all that. 2010, I was privileged to attend a conference organized by Association of Rural Surgical Practitioners of Nigeria, ASPON, in Boko, Benue State. And I met a lot of doctors, people like Professor Chimagio, former Director General in the Federal Ministry of Health, Medical and Dental Council of Nigeria. I met the likes of Dr. Charles Agbamusagwa and also other eminent doctors like Dr. James Ibeto Muna. These are very, very elderly practitioners. And in that conference, we discussed a lot of things, and I also observed a lot of things. And by the time we left the conference, I felt that I needed to do something to help the common man on the street. I also felt that as doctors, sometimes we have priced ourselves above the reach of the common man, perhaps because of the economy, perhaps because of the cost, the overhead cost. But still, I also felt that somehow we have to look for a way of making our services accessible to the ordinary man on the streets. And that was how we established the Graceland Hernia Foundation. Our mission statement then was to eradicate hernia in Nigeria. And of course, we know that that's a very tall, vision, almost impossible. But basically, that vision statement is supposed to encapsulate our set goals. While we may not be able to easily eradicate hernia among Nigerians, we can start by taking hernia surgeries, one after the other, by taking the patients on one after the other, and gradually, over time, we should be able to make significant impact in the preponderance of hernias among Nigerians. When we started, the way it was conceptualized such that we wanted a situation where we will have private individuals who are well-to-do, where we have the churches, the clubs, associations, community associations, professional associations coming in and helping us. Since we know that basically, carrying out surgeries is not an easy task. We needed money, we needed expertise, we needed drugs, we needed surgical men, we needed a well-equipped theater to do that, and so we need some money. And we hope that if we are able to approach some organizations like churches and community associations, they will come forth and assist us. As I speak to you today, we are still hoping and expecting. We have not seen any help whatsoever. But having said that, I think we should hasten to add that there have been a lot of well-meaning Nigerians who have supported us in one way or the other. We have organized several workshops, and this workshop has cost me personally as an individual a lot of money. And I will have to invite a lot of doctors who ordinarily will not collect money from us for assisting us to carry some of these surgeries. But when they are coming, we need to make arrangement for their hotel accommodation. We need to make arrangement for their feeding. We need to make arrangement for their movement around. We need to make arrangement for their general comfort and well-being and security. And when they are leaving, it behoves on us to also give them honorarium. Honorarium can be as low as 10,000. It can be as high as 100,000. This is a token for them to say, okay, thank you for coming. And so that when next we call them, they will not be reluctant to come. And so we found out that it was very, very expensive. I've personally spent about 2 million naira in a workshop. And then because of this financial challenge, it is not something we can do as often as we desire. And there's a lot of people that want to benefit, but because we cannot organize as many times in a year as we love to, we have to scale down. And so we're handicapped. But after about the first 2 years of the operation of the foundation, we devised another means. And that is we made surgery a daily basis, a daily affair. So that when you come to us and we discover that you are having hernia and you don't have any coexisting pathology that could warrant us not being able to do it, like some people have hypertension, some people may have diabetes, there could be other debilitating diseases like heart failure. These other diseases would definitely prevent us from kind of surgery on some patients. But where we don't have this, we take the patient to theater immediately and have it done on a day-to-day basis. By this approach, we have been able to do 2, 3, 2, 3, 2, 3 on a daily basis. As I speak to you today, I can say categorically that about 1,000 or close to 1,500 patients have benefited from the foundation. We have had patients who come all the way from Badagry. We have patients who come all the way from Ibadan. Patients come as far as Abeokuta, as far as Shagamu, as far as Ikorodu. My father of blessed memory, was always fond of saying this, that by the time a man has lived 50 years of his life, instead of looking back, it's easier for him to look ahead. And what that simply means is that by the time you're already 50 years old, then it is possible, most likely possible, that the years that you have expended behind you is far more than what is left behind. The Bible says our years on earth is 310, which is 70. So by the time 50 years is gone, you have 20 more to look up to. And within that 20 years, the greatest job that we can think about is the job that will immortalize us. The job that you do that will make the world to remember you. And that is why we find it necessary to think about what can we do to our fellow human beings that will not necessarily be denominated in naira and kobo, that will not be profit-oriented, that will not be as a business. For personally, that's where I see it. I want to see myself as somebody, who think of the less privileged, who do not think of my patients as only those who can afford my services, those who you render a help to and you think that one way or the other, God will recompense you. And that is the basis. Because of the way the issue of finance, today we also have a workshop that I organized in Ondo State. We've done 2 workshops now. We did one in 2012. We did one as recently as 2014 March. In 2012 in Ondo State, we operated 47 patients in 2 days, free, absolutely free. They won't pay me a dime, except maybe for the money they had to pay to go and do their lab test. Even the drug, I had to get the drug for them. So we took about 23 doctors in 2012 and about 20 nurses, and we did 47 surgeries, free. So in 2014, I went there, we did 78 surgeries. We went with 40 doctors and about 60 nurses, including camera crew, for the purpose of documentation. Now, in this workshop, the patient don't pay anything. I consider it as mission field. They don't pay even a token. I cover all the money. Sometimes I get assistance from the like of the council chairman, sometimes from the hoteliers who give us complimentary rooms, and sometimes from the church who help to feed our contingent. Then sometimes we get some drug from pharmaceuticals who sometimes decide to help by giving us a fraction of some of the drugs that we may need, you know. And apart from that, the foundation also organizes cervical cancer screening for patients, and we have organized at least up to 4 workshops, in which case we take, you know, the knowledge of cancer down to the communities and to let our women know that apart from India, Nigeria is probably perhaps the largest country where cancer is the cause of mortality. And ironically, this country did not have any plan whatsoever, either to mitigate the scourge of cervical cancer among our patients, our population, or to even deal with it when they are discovered. We have no plan. So I speak to you, the Ministry of Health has no plan whatsoever for or against cervical cancer. So this is some of the mission that we are into. Generally, this is the activity of the foundation. But like I said earlier on, the area we have made significant impact is actually in the area of procuring surgery for our patients at no cost to them whatsoever. Like I said, initially when we started, you do not have to pay not a single naira. In which case the foundation will take care of you, both surgery, both drugs, and everything. But we realized that it was such a huge burden for us, and we couldn't sustain it. We realized that it wasn't going to go far, and the assistance that we were expecting was not forthcoming. So later on, we now redesigned the program so that all beneficiaries will contribute a fraction of what is supposed to cost them ordinarily, less than 10% of what is supposed to cost them, which we now roll over as a revolving fund so that the program can be sustained. And that's how we are doing. So today, we started with 15,000. Once you pay 15,000, that includes all the tests you will do, and the drugs you will take, and the surgery. But today, we have increased it to 20,000. So once they pay 20,000, it covers drugs, it covers tests, it covers card registration, and the surgery. And that's how we have been able to sustain it.
I'm Dr. Abimbola. Okay. Hernia Foundation is an initiative of the Medical Director of First Graceland Hospital. Yes, it's an avenue to help the poor. We discovered that most people actually have this ailment, but they don't have the wherewithal to have it done. On average here, we have about 4 to 5 surgeries per day, on average. Sometimes it could be less than that, but that's just an average figure. And we discovered that most people come to do this. When we ask them questions, like click them and ask them questions, discover that they've been carrying this for years, but because they don't have the wherewithal to have this done, they tend to live with it. But at a reduced price, they come and they have it done. Okay, you come. It's a day case. You come in the morning, and then by afternoon, you would go because we only keep you here till afternoon to watch you. Actually, the whole surgery doesn't take more than 2 hours at maximum. It's about an hour to 2 hours for the whole surgery. It's a day case, and you don't have to stay in the hospital. Or you could do your dressing anywhere if you come from far, or you could still come back here to do the dressing if you are staying around.
Oh, Graceland is a very good health institution. Graceland Hospital, very good, and humanitarian. In fact, they reduced the cost of all the operations that they performed here that particular day. If, for one thing, operation or surgical operation of hernia will have gone for something above 100,000 or perhaps 150,000, but they reduced it to 20,000. Took 20,000 naira from us, from most people that actually came here. Everything is adequate. The drugs and the dressing, and then the operation itself, went well, and they did all the codes, and all the patients are very happy. I've not actually. I talked to one doctor about it, and we discussed, but the price was on the high side, and consequently, I started looking into the newspapers, and fortunately for me, I was able to get Graceland Hospital, and which rightly came to my assistance. Yes, as a stranger, I walked in here straight, and then since they have the mind of God, so they were very open, very transparent, and then they were very efficient and effective in all their drug administration. And so when they attended to us one after the other like that, without wasting much time. Government has been trying its level best as far as Lagos State is concerned. Government is trying, but in this particular respect, they should make this surgical operation affordable to poor masses. Graceland has the grace of Almighty God is always with them, and the mercy of Almighty God will be with them, and we are grateful. I'm grateful because I have never come across such a foundation before. And definitely all the government hospitals are treating hernia issue. They are. But what we are saying is that we have free medical health care. The government should do more and make it more affordable to poor masses, just like what Graceland has done.
Mrs. Busola Adeye, I'm a civil servant. Is Israel Adeye, 2-year-old. Hernia, since 9 months. I observe it since 9 months. I went to Ogutolu because that was where I gave birth to him. I went to Ogutolu to complain then. But the doctor that attended to me, he told me that when Israel is 2 years, that I should bring him back for the proper operation that they are going to. And I said, no problem, still. When he's 2, I will take him back to him. But before Israel got to the hernia do swell up once in a while. There was a day that I even swelled up. He was crying. He was having pains all over his body. We now took him back. That is when we are now given a letter to transfer him. They will transfer us to the Ikeja Hospital. From Ikeja Hospital, due to the transfer us to Bagada, that we should go and do it in Bagada Hospital. It was my husband that read this Punch newspaper, and I saw it there. No, I didn't know anybody Yeah, we just walk in as a stranger. When we got there, we were told to sit down. There was the people that I met, they were sitting down here. I was not the first person that came here because I came with my husband and Israel also. We were told to sit down when the MD now came. And the MD came to address us that they are going to attend to us shortly, that we should be patient. That we are going to pay 1,000 naira for their card or whatever. That was the way. They even did more than 20,000 that was collecting from us, because after after paying 20,000, they were told that they are going to take its blood this thing sample. After that, they take his weight and so many this thing was that thing. So after that, that's when they were now told that they will do the operation for him. On getting here, that I was told it's 20,000 in the this thing Punch newspaper, where the 20,000 was written there, that that's the amount you bring, and you should bring extra money in case we pay for any other this thing. And when we got here, the MD also told us that it's 20,000 that we're going to pay for the hernia operation. I appreciate their effort over Israel's operation, and I thank them. I thank God that He used Graceland Hospital to save my baby's illness.